13 of the top 20 most polluted cities in the world are in India, where air pollution kills 12.4 lakh people every year and reduces life expectancy by 1.7 years. So what can we do to protect ourselves from air pollution? I'm at the All India Institute of Medical Sciences to find out. I'm meeting Dr. Randeep Guleria, who's the director of AIIMS and one of the world's leading pulmonologists. He will have the answers. I'm with Dr. Randeep Guleria, who's the director of AIIMS and one of the leading pulmonologists in the world. He's going to tell us how to beat air pollution. So how does air pollution affect health?
So air pollution has an indirect effect on health, mainly in the lungs, but there is more and more data that air pollution actually affects the entire body. When we inhale toxic substances, which are pollutants, which could be PM 2.5 or even now what is known as ultrafine particles, which is PM less than 0.1 micron, it reaches the alveoli or the lungs and it causes what we call inflammation and starts causing lung damage. So when we are talking of air pollution, we are looking at the short term or the acute effects and the long term effects. The short term effects are predominantly seen in the individuals who are at high risk, extremes of age, those who already have a cardiopulmonary problem. So if you have bronchitis, if you have a heart problem, if you're young or you're elderly and you are your sort of immune system is compromised, you have a higher chance of having a worsening of your underlying condition because of an acute exposure. So what happens is that you inhale toxic substances, it could be nitric oxide, sulfur dioxide or particulate matter. It causes worsening of your underlying bronchitis, asthma, heart disease leading on to heart failure, respiratory failure, and this leads to emergency visits, more medication need and overall high morbidity and mortality.
So do you actually see more patients getting admitted to hospitals?
Recent study which we have done following up are looking at our hospital emergency room visits both in the pediatric age group and the adult age group throughout the year. So time of the year when air pollution is less and when it's bad, and we've seen a direct correlation in the subsequent 72 hours of spike in number of patients coming with cardiac and respiratory problems as air quality deteriorates.
Does it also increase your risk of infections like tuberculosis or pneumonia?
Yes, so there is some data which suggests the chances of infection also goes up.
So what precautions should people take, both indoors and outdoors?
So that's a good question because very often we don't look at indoor air pollution, and as a matter of fact, if we combine the two, data from the global burden study which was published in the Lancet suggested that almost 1.27 million people in India died because of indoor and outdoor air pollution in 2016. So indoor air pollution of course is a problem in urban areas which is slightly different from what we see in rural areas. Rural areas, the predominant cause of indoor air pollution is the chula which is used for cooking, and it is done in poorly ventilated kitchens and sometimes the house is small. So the smoke not only stays in the kitchen, it goes into the living room, and indoors if there is a newborn baby or an infant that is also there with the mother who is cooking, that infant also gets exposed at that point in time when the lungs are developing to high levels of pollutants. So one has to make sure that if you have smoke inside, you have to have proper ventilation. Cooking should be done so that the fumes are not there. One should use better quality fuel, and that includes LPG or CNG. And secondly, one should try and see, for especially those people who are having an allergic tendency, the indoor exposure to toxic substances like paints that are used should also be avoided. Even dhoop agarbattis which are used very often, those smell and that fumes can also cause a lot of inhalation related problems, especially in people who are more prone to respiratory diseases.
Air pollution is high outdoors. What are the kind of precautions parents should take for their children? Should you keep the children indoors where air quality is bad? What can you do?
Very often we get letters from principals of schools that should we stop outdoor activities during the winter months. It's an issue of trying to balance things out. You understand the fact that outdoor activities are good for children. You encourage them to do sports. At the same time, you're asking them to run and sort of breathe air which is not good for them. So the issue is that when you have high levels of air pollution, definitely a lot of physical outdoor activity should be restricted. You should wait for the sun to come out and at least the pollutants to rise up. But it's a big challenge, and should you then move to indoor activities, and should you have air purifiers? Those are the type of things that a lot of schools ask. The solution lies in finding a permanent sustainable way out so that the air quality improves throughout the year and continues to improve over years. And that means, what do we need to do in terms of encouraging people to use public transport, become more eco-friendly, walk if they can rather than taking a vehicle. If children have to go to school, can they do carpooling? Can they use the school bus rather than everyone coming on the individual cars? One study which showed that the AQI is very bad in most schools at the entrance when the school starts and when the school is over, because there's so many vehicles parked out there with their engines running. The children who come out of school or go to school at that point actually are breathing very toxic air.
Do you think masks and respirators work, and if they do, how should you use them? Because there's a lot of leakage involved, and I've seen a lot of runners don't have it on their face properly.
Masks are something which you don't routinely recommend. High risk group of patients, we say that you can use a mask, a 3-layer surgical mask or an N95 mask, but it has to be worn tightly around your nose and mouth. Because if it's loosely worn and you breathe in, you create a negative pressure when you breathe in, and air will get sucked in from the side. And if a lot of air is getting sucked in from the side of the mask rather than from the filter, the mask is of no use. So you have to have a mask which is tightly fitted. But having said that, if you wear such a mask, does cause a little bit of discomfort. People are not very comfortable with it, and people have tried other things. There's a nasal filter which is available. But these are useful for people who are at high risk and are going to areas where pollution levels are high. Not enough data to say that it helps in the long run for everyone to wear a mask. It gives you a little bit of reassurance, but does it really decrease the exposure and does it protect you? I think for that we need a larger policy and a bigger plan rather than just wearing a mask.
Yeah, it may actually increase exposure because you think you're protected when you're actually not.
Exactly. It gives you a false sense of security.
And what about air purifiers? Would you recommend them? Do they work?
Most of the data for air purifiers looks at a room which is properly sealed, and the individual is in that room for most of the day. Most of us rooms are not properly sealed, even our windows, there's a lot of dust and air which comes in. The door gets opened very frequently. And again, the dimensions of the room may be very big and the air purifier may not have that much of capacity. So air purifiers also are not that effective, and obviously you are traveling in and out. Again, like masks, it may give you a little bit of feeling of reassurance that you find that it's showing a good figure in terms of the AQI. But overall, I think, again, it's not a permanent solution.
You're a lung expert. How effective are our lungs at adapting to change?
There is a limit to which the body can really adjust. So we have what we call a reserve. If our lung capacity falls to some extent, you don't get breathless, or you don't get any respiratory symptoms because that much of capacity is there. But that's taking advantage of that reserve which the human body has. And if that reserve is gone, then as you age, the chances of getting respiratory problems become higher. So it will cause problems in older life. It may not cause that much of a problem at a younger age group.
So do you recommend that people exercise when air quality is severe or very severe?
Not aggressive exercise, not outdoor exercises. You should wait till the sun is out. So sometimes people will say, what time should I exercise? Not early in the morning, but maybe somewhere around lunchtime would be a better time to exercise. You should continue to exercise. The benefits of exercise much more, but in an environment which is not as bad as what you are saying.
Thank you so much.